So I'm going to do a quick summary on the pass-through payment system for Medicare. So if you're a surgeon and you want to do a few things. Number one, you want to push innovation forward. You want to deliver the best care to your patients, but you're also probably wanting to push reimbursements a little higher. We always are thinking we've got the ceiling on reimbursements for things like the ambulatory surgery center or the hospital. And so the pass-through payment system kind of helped treat all of those. And here's how and here's why. So Medicare realized that we sort of had this capitated system for ASC reimbursements, and there was no way to kind of spark innovative new techniques and new technologies. So what they created was the pass-through payment system. And what that is a bucket of money or funds that's budgeted year by year to help spark innovation for new technologies. For example, this year we have a new technology that's called IHEEZO, that is an anesthetic that numbs the eye, that has very compelling data. The U.S. data showed that patients that used it didn't have to use any other additional anesthesia. In our practice, we use, that plus, let's say, oral anesthesia or IV anesthesia, but that anesthesia alone is quite powerful. It's a topical numbing drop. But anyways, a product like that, there's other products that's gone through the pass-through. There's one that's called Omidria, other ones Dextenza, Dexecue. So more or less all these products that go through pass-through have a temporary period of time, temporary, so it's more than 2 but less than 3 years, where they have a chance to have higher reimbursement for the products that's paid for by the governmental fund. And at the end of that fund, what happens is, depending on how much those products were used, the Medicare looks at that and cost averages and then raises the reimbursement rate for things like cataract surgery to then have a higher reimbursement rate to cover the potential of that product in the future. But at that point, you can choose to use it or not. And you might think, okay, has it really worked? Well, actually, it has worked. There's a governmental summary in 2018 that looked at 2017 usage of Omidria. And at that year, hospital rates for reimbursement were around $1,800. Omidria was used a fair amount. And at that, the Omidria usage was about $400 per use. At the end of that year, they then cost average that actual usage and say, we're going to now raise reimbursement rates $100 to $1,900. And then at that point, the whole system improved. Patients got better technology. Hospitals got higher reimbursement. At that point, at that new higher reimbursement, they could then choose, do they want to continue to use Omidria or not? ASCs like us also got a bump in reimbursement because our reimbursement is directly related to that hospital rate. So this is a system that can solve multiple things. Number one, it can allow for innovation, but number two, it can ultimately drive reimbursement rates higher for your ambulatory surgery center or hospital. Thanks.